Hello, nice to see you, everyone. I will just share the presentation. Might take a little second. So in the meantime, I will introduce myself. So my name is Nadia. I work at a street outreach team, and what we do is that we work with rough sleepers. Our team goes out in the morning, verifies rough sleepers, and then we try to support them into housing and with other things if necessary. My role within that team is that I'm a social worker, so I often work with the more complex people that come under our caseload, many of whom are neurodivergent. So these are kind of my credentials. I am aware that a lot of you that came here will come from a different professional background, so I will try to not use any jargon. Apologies if I do. Sometimes it's difficult to catch myself. And I'm also aware you might have, different experience or more experience than me. This is based on my experience working with people who are neurodivergent and seeing what worked in the past for me. And it's also based on research. It's not all just my ideas. I wouldn't want to take credit for something. So what's the agenda? First, we will talk about why is it important to consider neurodivergence while thinking about homelessness. Then we will talk about general challenges, and I will discuss different environments where a homeless person might find themselves and what challenges they might see. Then they get there and how can we support them through it. We will talk about rough sleeping, housing support services, temporary accommodation, and then in general we will talk about some ideas on what can we do better as services and as individuals. So neurodivergence is very, very wide umbrella. So for the purpose of the presentation, because we only have a limited time, I will be doing some generalizing. Just keep in mind that every person is an individual, so their needs will differ. Nothing I say in this presentation is gospel. Not every autistic person or a person with ADHD will struggle with the same things. So just keep that in mind. I decided for the purposes of the presentation that I will be speaking mostly about autism, ADHD, and dyslexia, and that is because they are the ones that I come across the most during my practice and that I most often see people self-identifying with when describing their difficulties. So many people who are rough sleeping are neurodivergent. We come across people saying that they have autism or ADHD very often when we're doing assessments with people. And it's important to keep in mind that not everyone will have a formal diagnosis. Sometimes people will say, well, I think I have autism, but I don't have any diagnosis. And sometimes people will not be aware that they have autism or ADHD, but maybe we as professionals see some traits with them that correspond with autism or ADHD, and then we can still adapt our practice to accommodate them, even if there is not a formal diagnosis. Sometimes people don't necessarily understand what adjustments they are entitled to, and that can be an important role for professionals to help them with that. And it's also, well, in this presentation, I'm speaking about rough sleepers and people who are homeless. Rough sleepers especially usually don't struggle with just one thing. So often people might be neurodivergent, but also struggle with substance misuse, also be on probation, have multiple things going on at the same time. So I will touch on that slightly as well, because it's not always possible to separate these needs. So I drew a lot on research that was called Not Naughty, Stupid, or Bad. That was a report of neurodivergent people experience of probation. And this was one quote that I thought was interesting. There are some things I don't understand about myself even now. Like, I want to understand why my brain tells me to do that rather than to do this. Why don't I think before I act? So if you're a professional that's in a service user facing role, sometimes it can be quite challenging if we can see what someone should do or what would be right for them to do, what would help them, but they don't necessarily see that. Sometimes it's just important to have a bit of compassion and think about what is that's happening for that person, and it's neurodiverse. There may be something that is making it more difficult for them to act on their plans. So there's also research that supports that negative life experience lead many neurodivergent people to turn to alcohol or substance misuse, some as early as 10 or 12 years old. It can also lead to isolation. But then if people have substance misuse difficulties as well as neurodivergence, it can be quite difficult to get support that's suitable for them, because the substance misuse services might not be fully trained or equipped to deal with their needs around their neurodiversity, and the services that are specifically for people with autism or ADHD might not be equipped to deal with people that have substance misuse difficulties and might not be able to engage them appropriately. So then sometimes people are missing on suitable support. So just some frequent difficulties that people with autism, ADHD, or dyslexia can experience. This was taken from NHS website. I didn't just made it up myself. It's by no means exhaustive list, and every person is different. So someone might struggle with this and someone else might not, while they still have the same diagnosis. So for autism, people often struggle with social communication, social interactions. People might engage in repetitive behaviors and routines, and they might experience sensory sensitivity. Sensory sensitivity means that people can be more sensitive than others to noise and any other sensory input, and this can lead to meltdowns, which is quite a loaded word, but can lead to quite intense emotional reactions. For ADHD, some of the difficulties is forgetfulness, restlessness, speaking out of turn, risk taking, and difficulty in prioritizing appropriately. For dyslexia, the difficulties are difficulty reading and writing, understanding written information, and understanding written instructions. I would say, especially with the dyslexia, it's important to think about when engaging with homeless services, are people getting instructions written on paper? Can they actually read it? Did someone check with them that even if they can read it, do they actually understand what it says, so they are fully aware of what is happening? I think that is where professionals can really step in and support individuals. So personal and social challenges, lack of community, lack of understanding, lack of employment, all these things can put autistic individuals at a higher risk of homelessness. Also, autistic individuals struggle with challenges in communicating and interacting with other people, which can lead to relationship breakdowns, and that is a very common reason for homelessness. And it can also lead to people being isolated. So then when their accommodation is at risk, maybe they don't have support network that can help them out in that situation, and they ended up rough sleeping. This is information from the Autism and Homelessness Toolkit, which I would recommend everyone reads as an additional reading on top of this webinar, because there's some interesting information. Quick look at the criminal justice system. So many rough sleepers are engaging with the criminal justice system in some form. What happens is that if someone is recalled to prison because they're on probation, this can lead to a total reset of their support. So someone can be, for example, put in a hostel. Some support can be put in place. If they're recalled for a longer period back to prison, then they might not have the accommodation when they come out again, and the support has to kind of start from a ground zero. There is not always great links between prisons and the outside systems, so there's not the continuity of care. This is again from the Not Naughty, Stupid or Bad report. People talked about feeling that they need to cause disruption to get attention. They felt like their appointment times were too short to actually discuss what support they need. And suitable adjustments were not being made for them, which led to recalls. So they kind of felt like they were asked to meet requirements that they were not able to. And they also felt like there was lack of continuity, and their workers and times of meetings were changing a lot. Again, if you think of someone for who routine is quite important, it can be quite difficult when the appointments keep changing. So I want us to have a bit of a think about how it might feel for a person that is neurodivergent on a street while rough sleeping. What is important to think about is that while someone is rough sleeping, they have very little control over their environment. There is cars, people, other rough sleepers, possibly a lot of noise, especially if people are sleeping in the city centres, which a lot of people choose to do because that is where most of the support services are concentrated, so it makes a lot of sense for people. But it also means that the environment is a lot more loud and rowdy. Also, it's difficult to have a sense of routine while rough sleeping, which can lead to mental health deterioration. I used to work with a gentleman who was rough sleeping, and he got very connected to his rough sleeping spot because it gave him a sense of security to be sleeping in the same place. And got to the point that he was very wary of leaving the spot for any reason whatsoever. So every appointment I had with him, I had to do at his rough sleeping spot because he was so worried that he would lose his rough sleeping spot and lose that sense of security that he built there. Also, sometimes belongings of individuals are removed if they are not with them because it's just seen as a trash and littering of street. But this can be really difficult for people because they are not always able to carry all of bags with them. Again, this was experience of someone we worked with who lost a lot of sentimental items because his belongings have been thrown away, and again, that is quite a difficult situation to manage. So a lot of these things are just how things are, not all of that we can control, but how can services provide a bit more of a consistency, thinking about who's approaching the individual. Are we sending the same worker to speak with them when we need to? Do we understand what their routine is? Do we understand what's the best time to see them? So, for example, the gentleman I was working with that was sleeping in the same spot and didn't like to leave, he liked to go and have a shower in a kind of clean himself in a public bathroom every morning. So I knew not to make the appointment in the morning because that would disturb his routine. And he was very little control over what was happening to him already. So it was good to have some sense of routine where we could enable it. Another part I want to speak about was how housing support services. So if someone is homeless or rough sleeping, but you don't have to be rough sleeping, even if you're sleeping at your friend's couches or with family, people go to Housing Solutions, which is the statutory service that helps people to find accommodation again when they are homeless. It can be quite a challenging process for people. So what usually happens is that people need to present, need to register, then they need to wait sometimes for a few hours, and then assessment is completed when they are asked quite a lot of personal questions, and then decision is made on if they are a priority need, which means that they would be more vulnerable than an average rough sleeper, or if they are not. So it can be quite a long process, and a lot of people give up before they get to the stage where they can actually be assessed and decision can be made. I don't know, some of you have probably been to Housing Solutions before. It's a big waiting room with bright lights. Often there's children that are either crying or playing, people shouting, sometimes people quite angry because they are maybe getting answers that they don't really want. People walking around, people's names being shouted. It can be sensory, very intense environment. What can we do as a professionals to help with that? Sometimes it can be really helpful if there is someone with the person. So that means that I like to go with people because it means that they can pop out for 5 minutes, have a break from sitting in the same room, and then come back. And that way they manage to sit there for longer. You can also speak to me if they're getting overwhelmed, and that helps as well. We can be a bit creative with the what support we put in place as well. So sometimes people can have fidget toys that worked really well when I brought it for some people in the past. Also, maybe offering people if they want to do some coloring. I find it with these two things a bit difficult because some people can find it infantilizing, but actually overwhelmingly the response was positive when I offered activities like that to service users before. Also, it's important to know what's available from housing solutions side. So it is possible to ask for assessment over the phone if there's a reason that the person cannot come in person. So that is where professionals can step in, because you can contact housing solutions, explain why it's difficult for the person to attend, and ask for the over the phone assessment. And now housing solutions also have a rough sleeper navigator who can do assessments on the streets, which is really helpful as well. It's also important to think about the fact that, if often when people wait for things, we can be on our phone or read a book or something like that. But rough sleepers often don't have a phones, so they are really kind of there and now and need some form of entertainment. So sometimes it's as simple as just physically being there with the person so they have someone to speak to. So the research from 2022 about autistic experience of homelessness found that participants who had autism diagnosis when they approached local authority often did not qualify for support from them. And struggle to explain how autism impacted their day to day. So again, this is where having professional with them can be really beneficial, because they can explain what difficulties the person is facing. And this is a quote that I thought was really important to keep in mind from the same research. So I will read it out. Autistics who appear to be functioning like me, society just go, well, you are fine, you don't need support, and then there is nothing. We fall through the cracks, especially as adults. The way labels are applied is generally not how the person is functioning, but how well they appear to be functioning. So, mild autism is having a mild effect on other people, and severe autism is having a severe effect on other people. It's nothing to do with the individual themselves. And I think this is really important to keep in mind. Some especially autistic individuals, but also individuals with ADHD might be putting extreme amount of effort into appearing quote unquote normal to not cause any difficulties, but this does not mean that they are not struggling or that this takes a lot of effort from them. So, temporary accommodation, what it is. So, if housing solutions decide that you have priority need, which means that you're a person who is vulnerable as a result of old age, mental illness, learning disability, or physical disability, housing solutions should offer you temporary accommodation. Often it takes a form of hotels. People are often not placed in the same hotel but have to move between different hotels, and because of a lack of accommodations, people can even be placed in hotels outside of their local area, which can be especially challenging if the people are used to being in a city and have support networks in the city. If the person, for whatever reason, misses their hotel booking, housing solutions can discharge a duty and they no longer have to accommodate them. But the person has a right for this decision to be reviewed and for it to be reviewed if the offer was suitable and if the reason why they missed the booking was valid. This can be quite a challenging process. Again, this is somewhere where professionals can step in and help advocate for the individual. Just a bit of legislation. Consideration of whether accommodation is suitable will require an assessment of all aspects of the accommodation in the light of the relevant needs, requirements, and circumstances of the homeless person and their household. So it is really important that during the assessment, people are frank about their needs and explain their needs. So another form that TA can take is hostels, homeless hostels. People might be familiar with places like London Road. It's usually accommodation where a person has a bed. Sometimes it's a ensuite bedroom. Sometimes even the bathrooms can be shared, so the people kind of have a room of their own in a shared house or shared building. So it can be quite a busy environment because it's a lot of people living in the same space, which can bring quite a few challenges. The transition itself from rough sleeping to living in a hostel can be quite a big change. Often we see that people don't start straight away using their bed, but they continue rough sleeping uh, sometimes. And that is because sometimes people are just not able to go straight from the being used to sleeping on the street to starting sleeping inside. It can be more difficult than it seems. There is quite a lot of advice in the autism toolkit, so I would advise again to look into that more. People might, when people move into the hostels, they might struggle to understand rules and personal boundaries. It's good to be very clear with people when they are moving in about what the rules are, what rules they need to follow to not lose their accommodation. If something is not working, there are possibly some behavior difficulties. It's important to ask ourselves why. Is there anything that's making it more difficult for the person to manage in the hostel? So, for example, overcrowding and support needs of other residents can lead to concerns around confrontation, interpersonal interaction, and social anxiety. Uh, Someone also said about their experience, I really cannot cope with the unknown. I need to know what is going on. I need to see picture. So sometimes when people are in one homeless accommodation, they are moving to another homeless accommodation. This can all be very quick. So sometimes when beds come up, they need to be filled in within a day or as soon as possible. So people have very little time for the transition, which can be quite challenging. So, a bit more about what the autistic experience of homelessness research found. They found that in hostels in general, there was a lack of adaptations being made without official diagnosis. And it is very difficult to get a diagnosis when you are rough sleeping because while you're concerned about where you're going to sleep, what you're going to eat, how you're going to be safe, getting autism or ADHD diagnosis is not going to be on top of your priorities necessarily. Also, it can be very difficult environment due to all the sensory input, and these environments can become very busy. People also have limited control over their future housing, which can cause individual anxiety, and there can be frequent and quick and unexpected move-ons. So, what the research was found that some people decided to choose continue sleeping on the streets because that way they didn't have to deal with all the difficulties described above. They didn't have to be forced into social interactions, and they had control over their sensory environment. And that is something that we sometimes encounter in our work. That people would rather rough sleep than sleep in a hostel because they can find the environment really challenging. Moment of reflection, I thought this was really interesting bit of research. People on the autism spectrum are more likely to be viewed as deceptive and lacking credibility compared to neurotypical individuals. That's just something to keep at the back of our mind when we're working with people. So, some accommodations and considerations. At the top of the screens are some accommodations on a more personal level, what can we do as workers, and the bottom screen has more systemic suggestions. So when we're working with someone who either is autistic or has ADHD or dyslexia, we need to think about how we need to adapt our communication. If someone has dyslexia and cannot necessarily read, if they get a notice about their accommodation ending soon. Is it enough that they get a notice in writing? Do they need someone to sit down with them and walk through the requirements to make sure that they don't lose their accommodation? Is that what is needed? It's important to get to know the person on an individual level, find out what their routines are. If someone is missing a lot of one-to-one sessions with their support worker, why is it? Is it maybe because it's booked at the time when the person is doing something else every morning? Is that maybe one of the reasons? Could we try a different time? Could we try a different place? Sensory sensitivity. Are we doing the meetings in a place that's comfortable for the person, that's quiet enough so they can concentrate, somewhere they feel comfortable? Do they have any interests that are quite important to them? I mean, this will depend from a role to role, but if there's anyone who's here who, for example, works in accommodation, are we making sure that we're talking to people about what interests them, not only about their needs? Yeah, are there any sensory sensitivities? How can we help them manage change? If there's any move on, can we show them pictures? Can we show them around before they have to move? We can also use screening tools. So if we're not qualified, we cannot diagnose people, but the Autism Toolkit has some helpful screening tools that can help us to identify who might benefit from changing approach, possibly, and maybe from starting to having conversation about diagnosis. It's really important to advocate for individuals with other agencies and continue educating ourselves, which you are all doing because you are here today. Then is there any ways that the hostels or services are working that maybe need adjusting? Is there any way we could involve people with lived experience in changing these services? Is the staff training implemented in all services? And are we aware of different forms that neurodiversity can take? So I mentioned already using screening tools can be helpful. It's important to advocate with other services and facilitating collaboration with other services. It's also important to continue educating ourselves and sharing our knowledge with our colleagues and bringing neurodiversity into our conversation. So if there's a problem that's being discussed, maybe it's an angle to consider. Is this something that the person is struggling with? Is there some ways we can adjust our approach that would work for them better? So these are the resources I've used. I believe Justine will be sharing the presentation with everyone afterwards, so you can have a look through that. And yeah, that is the presentation done.
Thanks, Nadia. We haven't got any questions in the Q&A box, so I don't know if anyone's got anything that they want to just pop in there, and then we can ask Nadia for her response on them. If anyone's got anything from the presentation. Wait a few minutes to see if anyone's got anything that they want to type in there. Someone just asked, would you be able to show the toolkit, please? And we can share.
Would you be able to share it when you send out the
Yeah.
slide?
Yeah, we can share that. Yeah, that's fine. Yeah, we'll put it. So after the presentation, what we'll do is we'll just follow up the webinar in an email, and that will just contain the feedback form, the slides, and we'll attach any of the resources as well. There's another question here that says, do you believe services have the right resources to adequately support neurodivergent service users at the moment?
Um, not always. It will depend service from service. So I wouldn't want to put everyone in the same bag. But I think in supporting anyone effectively, you need to have a good level of staffing. So you're able to spend time with people and get to know people, and that's really key in being able to support people effectively. So services can always do with more staffing and more time and more resources, I would say.
Thank you. So the next question, it says that you mentioned you adjusted your practice with people. Can you say how you adjust your practice?
Yeah, so some things I mentioned in the presentation, sometimes it can be the way I speak to people, sometimes it can be the amount of time I meet them. So part of my role is that I do social care needs assessments from the council, and with some people that took quite a long time to warm up to me. I had to meet them quite a few times before they started speaking to me more openly. So I would make sure what worked well with some people was keeping appointment at the same time at the same place every week, so they got used to it, they got used to my face, and then they felt like they can speak to me more. Sometimes it can be about some people might prefer writing to speaking. So I was in a meeting in the past where the questions were written down and the person written answers out in hand rather than speaking. And they were able to communicate a lot more this way. So yeah, that is some of the ways. I'm sure there's more ways. I will let you know if I think of something more. Or making the appointments really short but more frequent. For some people with ADHD, I found that works better. They're not able or even walk during appointments, speaking to them while we're doing something else rather than just sitting them down and chatting. Hope that helped.
Thank you. The next question, it says, does the service use resources such as Easy Read?
I don't necessarily, but we don't really, in my service, we don't really give people much things in writing. We usually like communicate with people. Uh, I'm sure some services would do. I'm not that familiar with, yeah.
Okay, thank you. There's another point here. It says, just thinking it would be helpful to know of any suggestions regarding examples of how it has been successful. For example, challenging local authority decisions and in terms of housing to ensure that someone's protected characteristic of neurodiversity is taken into consideration, particularly when people may not always have a diagnosis, as this is difficult to obtain.
Yeah. So the question is about example where it was successful in the past.
Yeah, so if there's any examples where a challenge from a local authority decision has been made.
So I can think of more like a few little things where maybe someone has lost their temporary accommodation, but then the professionals contacted the local authority and explained all the reasons why they were not able to attend and made it clear that they were not able to attend because of their support needs. And then sometimes the decision can be overturned. But also I would say significant way in which professionals can support is that, service users are not always aware of their rights, and they don't always want to go through a review process or appeal process. So having professional that can walk them through that and provide evidence can help. Sometimes professionals can provide a support letter about the needs that they observe that the individual has, but unfortunately it is difficult if there is no diagnosis and the individual is seeking support. I would maybe say it's helpful if you can get like an opinion of maybe more medical professional or mental health professional that they're saying, oh, I think this person might be neurodivergent or they might have autism. Sometimes that has a bit more weight to it if they provide support letter like that.
Thanks, Nadia. That's the end of the questions, unless anyone's got anything else that they want to put in the Q&A box. But there's a couple of comments in the chat just around somebody's put in there around being a speech and language therapist and found it really pleased to see that you're holding in mind communication needs and reasonable adjustments around communication being a key adjustment. And someone else has commented on the good insight into the needs of people that you have, and really acting as an advocate for people. So
I would just add one thing I forgot to say during the presentation, and I think can actually be quite helpful. When someone is having assessment at Housing Solutions, you can request to do it in a separate room, not in the big room, and they should try to facilitate that. Some housing advisors are more accommodating with that than others, but it is something we can ask for, and that can be a real game changer for people that struggle with easy distraction.